Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Coenzyme Q10 is an extremely well-known supplement, and it's really very safe and it's incredibly beneficial. It was first discovered in Japan at the turn of the 20th century, and the research has been mounting ever since. A great deal of the research comes from Texas, where a lot of the work was performed. In fact, the CoQ10 we use, the active form Ubiquinol, actually comes from Texas. And it's been found to be core to metabolism. It's at the core of producing energy from all foods: fats, carbohydrates, proteins. It affects our ability to create energy. Now, for coenzyme Q10 to have this effect, and of course it's natural to the human body, it has to be converted into a different form in your body. So the CoQ10 that most people buy in a health food store or a pharmacy has to be changed before it works, before it benefits you. This active form is called Ubiquinol. Now, there's very strong evidence that it truly helps protect you if you suffered previously with a heart attack or a stroke, or if you suffer with heart failure. It's the Ubiquinol form that will offer the best level of protection. And here's the issue. Many people fail to adequately convert classical CoQ10 supplements to Ubiquinol. So they would be far better off if they switched to a Ubiquinol supplement. So welcome to my episode. Take this supplement if you've had a stroke or a heart attack. Hi, my name's Jerry Hickey. I'm a nutritional pharmacist. I'm a licensed pharmacist. I've been doing this for many decades. Welcome to the episode. You can find all of our episodes for free wherever you listen to podcasts, or just go to invitehealth.com/podcast. We have hundreds and hundreds of, Invite has hundreds and hundreds of episodes. You can also find us on Instagram, Twitter, and Facebook at Invite Health. And of course, please subscribe and leave us a review. Now, there's different forms of stroke. The most common stroke is an ischemic stroke, where something blocked the flow of blood in the brain and parts of the brain can die. And there are supplements that have some utility in helping lower the risk of a stroke. The biggest cause of a stroke is high blood pressure. The second leading cause is an arrhythmia of the heart, and arrhythmia means improper beating pattern. The heart has to have a dependable, normal beating pattern. But in atrial fibrillation, the second most common cause of a stroke, the top chambers of the heart are fluttering, and there's all kinds of crazy patterns: skip beats, triple beats, etc. The heart's racing. And what happens, little red blood cells get left behind, and clotting factors can adhere to them, and eventually they shoot out of the heart and can go into the brain and cause a stroke. So after a stroke, Ubiquinol really becomes quite important. This is the Journal of Molecular Neuroscience. Neuroscience, of course, is the brain. There's a number of studies of Ubiquinol with the brain in children and adults, neuromuscular studies, brain studies. So this is a large group of stroke patients. And what they did, within less than 24 hours, they measured the level of two nutrients in their blood. SOD, which stands for superoxide dismutase, a major antioxidant enzyme that defends your brain. SOD levels tend to crash and burn after the age of 55. They're pretty much very low in everybody after the age of 65. And Ubiquinol, which also drops in your heart, your brain, and your muscles, etc. with age. So these are two major protective factors. So they found in people who suffered a stroke, when they measured within the first 24 hours, there was a a really big drop in SOD and a really big drop in the level of ubiquinol. And they found a correlation over time between the level of damage from the stroke and the drop in these two nutrients. And they also found a correlation between reduced mental function after a stroke, like 6 months later, and the catastrophic drop in SOD and ubiquinol. Now, the left side of your heart pumps out oxygen-rich blood to the body. To do this, it passes through a valve leading to the biggest blood vessel in the body, the abdominal aortic artery. The valve is called the aortic valve. So blood is pumped from the left lower chamber of the heart. It goes through this valve, the aortic valve, and enters the aorta, which brings the blood all over the body, so you get oxygen and nutrition. So the valve allows blood to be pumped out of the heart, but prevents backflow of the blood. It prevents the blood from re-entering the heart inappropriately. There's a condition called aortic stenosis. The valve is narrowed, and there's different levels. And symptoms, when you truly have some level of aortic stenosis, you can have severe fatigue and tiredness after exertion, shortness of breath, chest pain. Other things can happen like arrhythmias. So it can lead to strokes, arrhythmias, heart failure. The age of patients with aortic stenosis is rising. People are living longer. And unfortunately, this compromises things, like the level of benefit for the surgery is reduced. There's more complications in these people. There's poorer outcomes. There's reduced heart performance. So there was an Italian study published in the journal Aging. The journal Aging is published up in Albany, New York. And 50 elderly patients with severe aortic stenosis, they were going to undergo surgery for aortic valve replacement. They gave them ubiquinol or placebo. Ubiquinol prevented an increase in troponin 1 after the surgery. That's really important. Troponin 1 is found inside the cells of the heart, and when they're damaged, it leaks out of the heart. So there's a rise in troponin 1 that signifies the amount of damage to the heart. There's a correlation there. In fact, after a heart attack or a suspected heart attack, doctors will check the blood for troponin 1, and if they see it's elevated, they know that the person had a heart attack. So the ubiquinol prevented an increase in troponin 1, meaning that it was preventing damage to the heart cells and the heart muscle. The heart was stronger after the surgery on ubiquinol with improved health versus no ubiquinol. So the strength of the heart was improved. And the risk of suffering with congestive heart failure or an arrhythmia, an improper beating pattern which can lead to a stroke, or stiffening of the heart, fibrosis of the heart, the risk of all of these was decreased. And so was inflammation in the heart. So it's all very good. Let's look at heart attacks. Heart attacks typically occur when something blocks the flow of blood in the heart, and part of the heart muscle dies. And one of the outcomes of a heart attack, besides arrhythmias, is heart failure, where the heart stiffens and enlarges, and it becomes increasingly hard for the heart to pump blood. So this is the Journal of Cardiovascular and Thoracic Research, and the researchers looked at the quality of life in 128 patients after they suffered with a true heart attack, not a minor heart attack, a real heart attack. Now, they were on the best drugs that medicine has to offer, like beta blockers and ACE inhibitors and ARBs, etc., and aldosterone blocking drugs like triamterene. The lucky patients were placed on a better diet, and the researchers focused on raising their plasma levels of ubiquinol and L-carnitine through supplementation. So ubiquinol allows you to create energy in the heart and in your muscles and in all of your organs and tissues throughout your body. Carnitine is similar. Carnitine feeds your cells of your heart and your brain, etc., with the precursor for creating energy out of food. So they're both very important after a heart attack, ubiquinol and L-carnitine. Now, through the supplementation, compared to the other groups, because some of them were not placed on diets, some of them were not placed on the supplements. Compared to the other groups, supplementation increased their quality of life. They had a lot more energy. They had an improved mood. Their emotions improved. But their prognosis also improved. The doctor said, hey, you're going to do a lot better with the better diet and the ubiquinol and the carnitine than if you didn't have these supplements and a better diet. Now, this one is really telling. Heart failure is very scary. They classify heart failure according to the New York Heart Association classification. Stage 1, hey, you don't even know you have heart failure. Stage 2, you probably have a little trouble breathing and you're probably fatigued after exercise or physical activity. Stage 3 heart failure, you're experiencing the symptoms just sitting in a chair. I mean, you're just sitting on the couch watching TV and it's hard to breathe and you're fatigued. And stage 4 is really scary. Stage 4 heart failure is more scary than HIV because people with HIV infections are now put on a cocktail of drugs that keeps them alive. Stage 4 heart failure is as scary as advanced cancer, and it has a very poor prognosis and a short time. I mean, it's just not a good thing. So all of the patients, it's a Danish-run study, 420 patients with severe heart failure. So the New York Heart Association classification was stage 3 or 4, so it's not good. And they were already on the best medications, like the beta blockers, like the ARBs, like the ACE inhibitors. They were supplemented to increase their ubiquinol levels, or given placebo. Here's the results. They were amazing. It was over a 2-year period. For people with class 3 and class 4 heart failure, 2 years is a very long time. With the ubiquinol, 43% reduction in cardiovascular related deaths. In other words, a death from a heart attack or an arrhythmia, like ventricular tachycardia, where the lower left chamber is racing, or sudden cardiac death. So a 43% reduction in dying, a 42% reduced risk of dying from all-cause mortality. So that could be anything, including infections, because don't forget, these people, their immune system's compromised. It's not working well, so it's easy for them to get infections, even heart infections. Their NT-proBNP significantly improved. Now that's important. NT-proBNP is a protein found in the cells of the heart. And cardiologists and interventional cardiologists will look at the level of NT-proBNP in the blood to see how damaged the heart is, or if their medication is improving this patient's health. So when you have a heart attack and heart failure, NT-proBNP is leaking out of the heart and the level in the blood rises. They found the level of NT-proBNP significantly improved, significantly dropped. Now I have to tell you, there's other studies showing this, where they gave older people ubiquinol versus regular CoQ10 versus placebo, and only the ubiquinol improved NT-proBNP in older people. Hospitalizations were greatly reduced. The need for a heart transplant was greatly reduced. The need for being put on a mechanical pump to help the heart work was greatly reduced. But there's a lot going on here. So in the American Journal of Cardiovascular Drugs, this is a Japanese study, patients with stable heart failure is safer than unstable heart failure, obviously, but they had a reduced ejection fraction. So that's really important. The heart is just not pumping enough blood to meet their needs, so they're not getting enough oxygen and nutrition to the brain and their organs and systems. Not a good thing. Fatigue, hard to breathe, a lot of symptoms here. They were placed on ubiquinol or placebo, and the ubiquinol greatly improved the function of their endothelial tissues. Now that's really important. Endothelial tissues line your blood vessels like a rug. These cells line your blood vessels like a rug, shoulder to shoulder, and they pump up in your blood vessels. So this is a reason why they were less likely to wind up in the hospital or have a second heart attack or wind up with a heart transplant, etc., because everything was working better for their circulation. Now, there's a lot to say about ubiquinol. I mentioned a study on my radio program many times that took place in Sweden. Linköping University, great research institution. the Karolinska Institute, another great research institution. And they gave elderly people supplements to raise their ubiquinol level, but also to restore their selenium level. Selenium is a mineral. It's involved with reducing the risk of certain cancers if you utilize it properly. Not everybody utilizes it properly. It's also needed for the health of the liver and the eyes and the brain, and also for the health of the heart. So to make everything fair, they had to give everybody selenium because they wanted to see did ubiquinol make a difference. So everybody was given selenium. Now, ubiquinol. When they gave these very elderly people, everybody was over 60, some of these people were in their 80s. When they gave these elderly people the supplements, it reduced their risk of dying from heart-related events by over 50%, such as a heart attack, an arrhythmia, heart failure, sudden cardiac death, all reduced. Now, they went back and looked at these patients 10 years later. So these patients were put on the supplements for 5 years. And then it stopped. And they revisited these patients 10 years later and 12 years later. They found that there had been long-lasting benefits from restoring the selenium and giving the patients ubiquinol. 12 years later, they still had a 40% lower risk of dying from something related to the heart, such as a heart attack or a stroke or sudden cardiac death. I mean, it shows that even for a limited time, if you took ubiquinol daily for 5 years, it just turned back the clock on your heart health. And your heart remained younger than your chronological health. So if you were 70 and you took ubiquinol, all of a sudden you had a 50-year-old heart. 50-year-old hearts don't normally have a heart attack. So when you're 80, you still had a 60-year-old heart. It's kind of like that. I mean, you can't directly quantify it and qualify it, but the heart was made younger. So I think anybody over the age of like 55 or 60 really should be on Canica ubiquinol. And I would take 120 milligrams a day with food. But if you have damage to the heart or if you've suffered with a stroke or a heart attack, you want to take more. So discuss that with your nutritionist or your doctor or your pharmacist. But certainly 240 to 400 milligrams a day would have a significant effect on improving your health. There are other supplements that could be beneficial after a stroke or a heart attack. Of course, you should discuss all of this with your healthcare professionals. Besides ubiquinol, in the brain, it could be Alcar, a form of carnitine that gets into the brain. In the heart, it could be carnitine. B vitamins are very important to both the brain and the heart. B vitamins, because they allow you to use calories for energy, especially B6, B12, folate, and riboflavin. The mineral magnesium can be very helpful. All of these have benefit after a heart attack, but once again, you need guidance on this. So I want to thank you for listening to today's episode. You can find all of our episodes for free wherever you listen to your podcasts, or just go to invitehealth.com/podcast. You could also listen to Invite on Twitter and Instagram and Facebook at Invite Health. And by the way, when you listen to our podcast, if you could leave a review and if you could subscribe, it'd be very helpful. Gives us feedback, the reviews. And I want to thank you for listening to today's episode. And this is Jerry Hickey signing off. Thank you.